Based Accountability 101. Some of you may have already taken this short introduction course, and it will be a refresher for you. And some of you are new to this concept. So let's walk through it. We're gonna do a presentation, and sometimes it may not make sense, but hopefully we will be able to make it more clear when we work through a working example. It is very common. So let's just take a couple seconds to read these. People and their managers are working so hard to be sure things are done right. They hardly have time to decide if they are doing the right things. It is not uncommon for us to be doing something, or we fall into a new role and we just continue doing what we were doing, and we just try to do it like the proper way, the best we can, but we don't stop and analyze to make sure that what we're doing is the right thing. So we're going to look at results-based accountability, RBA, as a framework, a process, and a culture. Excuse me. That was a chocolate chip, probably. It is a disciplined way of thinking. It goes from thinking to actually taking action, and it can be used to improve the well-being of communities at large, or smaller units, smaller sections, even programs within organizations. We're going to look at it from both points of view today, from the large population geographical area to the smaller organizational level. It's an ends to mean decision making. As a framework, we look at it that way. What does it mean? It almost walks backwards. We first look at how we're doing, what is our baseline, what's happening right now, and then we go and analyze. We walk through some steps, guided steps, repeatable steps that will help us go towards an action plan to turn that curve on that how we are doing right now. It can align strategic planning and program management and even budgeting. So we're all on the same field, and we're all speaking the same language, and we're all moving in the same direction, sharing information and speaking the same language. As a process, it promotes using the same language, and it's data-driven decision making. And not only the decision making, but it's through data that we will be able to analyze if we're going on the right track. And we can, again, do another turn the curve exercise I will show you later, and then analyze if we're going in the right direction and switch or modify accordingly to get to our ends again. Data promotes transparency, and it ensures accountability. We all know that we have progress to make. We have clear expectations, clear measures of how we're going to look at things and what we're going to look at. As a culture, it promotes simplicity and transparency. The use of a common language makes it easy for everybody to be on the same playing field, makes it simple. There's few definitions, and we all know it's simple. And transparency, again, with data sharing, it promotes dialogue, and it is through dialogue that we are able to gain insight that we would not be able to have as individuals. So this dialogue, this collective thinking will help us move forward. Going back to the language and simplicity. So we usually have too many terms, not enough definitions or too few definitions, and too little discipline to use words. RBA, through establishing common language and common definitions and few words to define, it aims to build a bridge among everybody and just avoid that language trap. One example is the Baltimore fire of 1904. Firefighting units from many communities around Baltimore came to try and help put the fire down. However, when they got there, they realized that their fire hydrants and their hosings, the couplings were not compatible. They had the problem of too many terms that were not standard. So they were not able to help. From that tragedy, there came a national standardization program. So all the couplings and the hoses and the fire hydrants are standard in order to avoid a problem like this again. So this language trap, usually we don't have defined, and sometimes we meet like in the networks, for example, we have several organizations and we don't necessarily speak the same language. And it's not uncommon for us to be at a meeting and someone starts saying these big words and that we're looking for measurable uh, goals that will align the qualitative results with the performance indicators that will lead us to systemic outcomes. I just totally made that up. And it may sound, for some people, it may sound impressive, but chances are, for most of us, it will sound confusing. However, we may not be inclined to raise our hands and say what? Because like I didn't understand anything because we fear coming across as not well prepared or ignorant or anything. So if we have a standard language, we can all agree on the terms we're using, and that will allow us less confusion, moving forward, simplicity. So as I mentioned earlier, when we talk about RBA, we can look at it from the population level or the smaller unit, the smaller entity, organization, even program within organization. So we talk about population accountability when we're looking at whole populations, and performance accountability when we're looking at smaller units, not geographically designed. So when we talk about population, we talk about a population, we talk about geographic area, and a condition of well-being. So those are our results. Population, for example, all children in Rochester are born healthy. We're going to use this example for now. Here we are at the population level, and we're looking for population results, which are all children in Rochester are born healthy. An indicator is a measure that will help us see, if quantify, if we're getting towards the result or if we're there. For example, in the example of birth weight or healthy babies in Rochester or children are healthy in Rochester, we could look at low birth weight babies or hospital stay after birth or the need of NICU beds. Again, population, geographic, well-being, a whole community, and it's a population result, and the way we measure it is through indicators. When we look at indicators, those measures that are going to indicate if we're going towards the desired population result, there's three things that we need to look into: the communication power, proxy power, and data power. Communication power is what we're saying, what we're trying to convey. Is it easily understandable by everybody who's involved? Can those who have decision-making power understand what we're talking about? Does it say something about when we talk about like the proxy power, does it say something about the result? For example, if we're talking about healthy children in Rochester, Minnesota, birth weight, what does it say? Does it say something about having healthy babies? Yes. So we can use that measure as a measure of health. Data power is like, is there quality data available in a timely basis? A data, in order to be strong, has to be credible. In order to be credible, it must be consistent and reliable and timely to track progress. When sometimes it will happen that we have an indicator that has a high communication power. It's easy to understand by everybody. It passes the public square test. It has strong proxy power, but there's not enough data available, or the data that we have is poor quality. So that's when we have to go and find or create a data development agenda to figure out what else we need to figure out. It's a prioritized list of new and improved and desired data that we want to look for our indicators. So again, this is what we have like briefly talked about: population, results, and this is the smaller scale. When we are now going to move to performance accountability, organizations, clients, units, or programs within our organization or a city. When we look at the smaller picture, we talk about performance accountability. And when we look at these measures to make sure we're going towards our goals, we talk about performance measures. We talk about the well-being of a smaller population. If we were talking about performance accountability, for example, we could talk about all children in Rochester are born healthy. And if we're going to talk about performance, we can say all children born at Olmsted Medical Center are born healthy. And when we look at how to measure it, there's three ways to look at it. How much did we do? How well did we do it? And most importantly, is anyone better off? When we talk about how much we do, is like we have to identify who our customers are, what services we provide. For example, in birth weight or babies born healthy, how much did we do? We can implement a strategy that at Olmsted County Medical Center, we will give every expecting mother a book about a healthy pregnancy and nutrition in hopes to improve the birth of their babies. How well did we do it? We can say we did a fantastic job because we were able to actually give a book to everybody in a safe way and early enough in the pregnancy so they could get the full benefit of it. However, is anyone better off? Do we know if these two other performance measures actually made an impact? So this is anyone better off is the measure that we have the least control over, but it is the most important one. Because at the end, how much did we do is not that relevant if it doesn't have an impact on what we're trying to measure. To be able to go from that ends to means, we do what is called a turn the curve exercise. And now that we know the difference, we use it for both population and smaller units. But now that we know the difference between an indicator and a performance measure, geographic and smaller units, we do this exercise, which is called turn the thinking exercise. Why turn the curve? Turn the curve thinking is a disciplined approach to every problem that incorporates data and the common language that we spoke about earlier on. It should be simple, it should be common sense, it should not last forever. I mean, we should not take long time creating it, unless we'll see about data later. And it should be useful. It should be something that we can go back periodically and look at it, and it should help us inform how we're doing, where do we need to adjust, how are the actions that we're implementing working, do we need to bring anybody else in the decision making. It can be useful from budgeting to measuring a unit, management, strategic planning. It is very useful as long as we do it in a systematic way. Going again to the population and subgroups. So when we work towards a result for the whole population, children are healthy. We look at indicators as we measure birth weight. We do a turn the curve exercise going through who are our partners, what can they do, and come up with an action plan. From that action, we come up with strategies that should be coherent. And those actions at the population level, it will usually include some programs. And that's when we move into the smaller unit of an organization or a program. These programs or strategies or initiatives, we will have to measure those. So the program, again, going back to the example, Olmsted County Medical Center, babies born at a good weight. We identify that as a performance measure for Olmsted County. For Mayo Clinic, we may identify babies who go to the NICU. We do a turn the curve thinking. Who are our partners? What can we do? An action plan. And then we create an action step. Notice that the examples for Mayo Clinic and Olmsted County are not the same. They're not measuring the same. However, when there's different partners or different programs, everything that they measure, even though it's not the same, will align and contribute to the end result at the population level. So a brief recap. We have seen what a population level and organization level difference could be. When we talk about the population result, the measures are called indicators. When we talk about organizations or smaller units, we talk about performance measures. Performance measures feed onto the end result of the population. For both cases, we work with a turn the curve exercise, which will take us from analyzing our problem to identifying what could be happening, who could we partner with, what works, and then come up with an action plan. So the best way to identify that curve and learn about that curve is repeatedly do exercises. So I'm going to walk you through an exercise in a small subunit. It's not a population level, it's a small unit, which is my family. And it is home cooked meals for my family. So this is what the home cooked meals for my family look like. Complete roller coaster, right? We can see some trends happen here, and this is how we get a baseline. So how are we doing? We're doing roller coastering, right? Sometimes we're doing great, sometimes it's doing awful, and I am going to ask you to go to the chat and get creative and speculate, why is that curve in my family going the way it is? What can be happening that I live in a roller coaster in terms of home cooked meals? So type away. Work schedules vary. Any other ideas? Okay, I'm going to start speculating myself. So we know if I don't change anything, if we don't change anything as a family, my forecast, given the history of this curve, is not looking great. The story behind the curve, work, yep, also structured. Kids during the winter school year, they used to have more structured routines. They would leave the house early in the morning, not come back. When the time they came back, they were starving because they had gone from school to an after-school activity, no time to snack all day long. Our summers are less structured because the kids work and I like being outside and they don't have school to keep that routine. So our cooking goes down. Here, February, I tend to help with a large event. And as the date to the event gets closer, I get super busy. And the last thing I want to think is about feeding my people. Uh, During the summer, I love being outside and don't feel like spending time inside cooking for anything. Um, Also, my husband travels a lot, used to travel a lot. So, and whenever he was gone, the kids would rather eat breakfast than have me cook something, anything. And then COVID happened. Look at that. I was cooking every single day because we really had no option. So, what would happen if we do nothing different? That forecast here. We will go back to eating out and ordering dinner from restaurants and falling back on old routines. So, when we look at the forces that have an impact on the curve or on changing the curve, there are positive and negative forces. The positive forces are that I actually enjoy cooking quite a bit. So that helps me with the home cooked meals. Structure, being able to predict each day also helps with planning. I know that because my kids have been in a structured day, they have not had time to be home and snack all day on the pantry. And so they will be hungry at dinner time. And then time. Whenever time, whenever I have time available, I cook. Negative forces are event season. I have no time to think or cook. My husband's trips, which are usually like around here, and time. Again, when I don't have time to cook, like here, nothing happens. Everybody's on their own. My kids are older, so it's not child neglect. They could also like cook for me. So So when we look at the story behind the curve, it is important that we find a root cause, or we try to find a root cause. In order to do that, we should not stay with the first idea that comes to mind. We should try to go at least 5 times asking why. So why can't I consistently cook decent meals for my family? Well, my summer evenings are too unstructured and I am too lazy. Well, why is that? Well, everybody has a different schedule in the summer, and I'm lazy when I'm tired. Well, why is that? Well, the kids are in different schedules because they're older and they need jobs. Why am I lazy when I'm tired? Well, I'm tired because I get involved in too many activities and we'd rather be outside than cooking. Well, why is that? The kids work because they need summer money. Why am I in so many activities? Because I love being busy. And why do I like being outside rather than cooking? Because I love summer. Why is that? Well, the kids need summer money because we don't like them working during the school year because they don't need another excuse to have the grades they have, to be honest. I love being busy because it makes me feel useful. And why I love summer? Well, we spend too much time inside during the winter. So, bottom line, why? It's because we as a family are too busy and meal prep is not a priority, even though we do love spending time together. So this is my root cause. Too busy, meal prep, not a priority. So we need to now find out what is the story behind the curve. What, in research wise, what are we going to do do I have enough information to change things around? Maybe I need some more. So we talk about like the research agenda earlier on. It's like maybe I need to find out if there are any services in Rochester that will help me plan ahead for a whole month. I could order groceries a whole month ahead and they will deliver them on time. So I don't have to be worried about every week. What do I do now? Are there any meal planning tools that are actually effective that other people have used and that are proven effective? Would it work if we pre-cooked things as a family on Sunday? Are there any other parents who maybe would like to be a part of a meal swap or cook together? So it's less, I don't know, you commit to something, so somebody makes you show up. This is when we go through a turn the curve thinking that I mentioned earlier. So how are we doing? We know we're not doing great. And right now you saw my curve, we're flat again to eating out. And uh, hopefully now as it gets colder again, we improve again, but nothing changed, to be honest. The story behind the curve is that bottom line, we are too busy to do meal prep and I'm too lazy to get organized. So now we need to find out who the partners are that can play a role in turning that curve and helping us have a sustainable meal cooking plan. In our case, it would be us, our children, my husband, myself, and other parents who potentially want to cook or share meals. Right? How are we doing? The curve. We identify the partners. And now we need to move on to what works to turn the curve. We do not need to reinvent the wheel every time. The things that we need to look when we're looking at what works to turn the curve are things that are evidence-based, low cost or no cost, off the wall, pie in the sky ideas, because you never know. They may be the best solution. And we need to find out if there's additional research needed. In our case, evidence-based, everybody says that involving your family, creating a monthly plan, prepare meals ahead for the weekend, all those organization things help stay on track and organized. Low cost, no cost. We could get up a little bit earlier every day, prep for dinner time, half rotating family members cook, and I promise not to complain about their cooking, do groceries from an app. Off the wall ideas, hire an in-home cooking chef who comes every night and and cooks for us and then cleans after themselves. And additional research, we could find other parents who would like to meal prep or swap meals with us. So we wouldn't have to be cooking every day. We know how we're doing. We know what's been going on with ourselves. And then we identified the partners as our family and other parents. And we have some ideas of what could be happening, what works to turn the curve. Once we have those, when we're choosing our action plan or our strategy that we're going to implement to turn that curve, we have to look at leverage. Is it connected to the root cause? Feasibility, are we going to be able to get this working? Because my idea of the previous what could work is hire an in-home chef that comes and cooks every night and cleans after themselves. However, it is not feasible. We would not be able to afford it. So why should we try to implement there? We know it's not going to work. We're setting ourselves up for failure. Specificity. Are the actions steps that we are going to take doable because they're bite size? So we should look into trying to get smaller steps so we can accomplish, measure, move forward, and reinforce the process that we're doing. And values. Is this consistent with our values? As feasibility, if we don't, whatever we choose is not consistent with our values, is not going to move forward. So we need to define our action plan or our strategy based on these: connected, doable, tiny steps at a time, and consistent with our values. So this is what we came up. I actually did run it with my family as our strategy to implement it. We didn't implement it, but we tried. We would have a conversation and assign roles. One of our kids, actually, he's the one who likes doing groceries. So most of the time, he's the one doing groceries. We would create a monthly plan, and that would include a shopping list. We actually did get an app, actually, that we all share in our family, where we start putting whatever we find out that we need to get. Not all of us keep that updated, so that's an issue. We use the grocery shopping apps and delivery apps. And we could use social media or our own network of friends to find out about other families wanting to swap meals. Coming to the action plan. The action plan, besides being bite-sized, it should be very, very specific. If we have a super lofty goal, we need to try and break that down into smaller steps that are doable. And those steps have to have a who that owns that step. It may have partners that help, but somebody has to own that step. Somebody has to be accountable for making that work. So we find the who, what that who is going to do, and we also need deadlines. We need to have a process time. We need to have when we're going to start and when we expect to end. If other activities depend on that, we have to make sure we end on time. So all of these helps be accountable. Everybody in the organization, back to the common language, everybody in the organization has access to an action plan or to the action plan in the on the group. So everybody knows who is doing what and when, and we can expect to move forward that way. So this is RBA 101 in a nutshell. We talked about two populations or two groups in which RBA can be used as a whole population when we talk about a geographic area, or as a smaller unit in organizations and programs, governments, agencies, etc. When we talk about population, the measures are called indicators. And when we talk about smaller units, the measures are called performance measures. When we look at performance measures, we have to, again, look at how much did we do? How well did we do it? And is anyone better off? Anyone better off would be the most important measure. However, is the one that we have the least control over. When we are looking at turning the curve, that exercise that we can do again and again to decide an action and then to check and recalibrate if that action is going to where we want it to go, we look at 5 core questions. How are we doing? That would give us our curve, how it's looking, our trend, our baseline, and our forecast. How it would look if we don't anything to change it. What is the story behind that curve? Remember, when you're thinking of the story, 5 times why. Get deep, because the first thing that comes to mind will usually not be enough. There will be several layers deep. Who are our partners who have a role in turning that curve? Either positive forces or negative forces. Think close to you, think right outside you, think way outside you. Just who could have anything to do with how we're doing and how we can improve it. Also, look what has worked in other places to turn the curve. Chances are, when you're looking at a problem that you are trying to figure out and solve, you're not going to be the first ones having this problem. So do your research of what is around that has worked in other communities or in other organizations that may have been facing a similar problem. Then once you identify that and you know how you're doing, what can be done, what's the story, how you're doing, who can help you, and what has worked in other places, you can come up with an action plan to turn the curve. That action plan has to be doable, has to align with your values, has to be bite-sized, so you can do it and implement it and get this thing ball running. If it's too crazy and not doable, you're going to be stuck. And when you're stuck, you're not going to be able to see progress. And it's very frustrating. The idea of this is that you can start seeing progress as soon as possible, so you can accumulate and go towards your end goal. And that is it for today. If you have any questions, I'd love to hear them. Given that there were not too many, just unmute yourself and ask me. Hopefully I have the answer. Christina, have you taken this before? Or you, Deborah, as part of leadership table?
Yeah, I think I've done it a couple times. I feel like it makes sense in my head for a while, and then then it stops making sense. So do you have any, I know this is 101, but do you have any examples of how this is working within the organization or the partners? Not like the whole, run through the whole example, but maybe things they're looking at this way?
Yes, so there's two networks up and running, the Kindergarten Readiness Network and the high school graduation, and they both went through this turn the curve exercise to come up with action plans. The high school graduation network first strategy was to implement cultural training, so the adults interacting with youth are culturally responsive and sensitive. They came up with that idea based on the some data that existed of the disparities that are happening with youth of color.
Okay.
So they came up with that. And then they looked at who are the partners that could be have an input into what's going on. So they looked at community trainings. They actually, we had 2 sessions with youth to get their input, and that COVID happened.
Got it.
So we would like to have more. And then we've looked at other communities that have done that. Even RPS, we've looked into RPS, that RPS is doing the training. So right now we are in the process of creating measurements to be able to have a baseline that is measurable so we can keep track of what we're doing and go again and reinforce the cycle before we implement the trainings. So we have that baseline, we implement trainings, and we go through another turn the curve exercise to see if it's moving us in the right direction.
Got it. So it's continuous improvement.
Mm-hmm.
And so just, throwing out, like, if it's graduation, say you figured, okay, maybe all seniors need a, one-on-one mentor, culturally responsive. We're going to do this for a year and see how it looks. And did that make any impact? Yes, it did. No, it didn't. Do it all over again.
For example. Yeah,
Yeah.
other things that have been floated for the high school graduation network are to look at truancy, right? Why is it happen? And how do we help kids that are truant? We have not implemented, but it may be a strategy coming up. Why are kids that are absent from school? Why are they absent from school? Who can be involved in getting those kids engaged so they attend school? What has worked in other communities? In other communities, we know that what has worked is, as you just said, having a one-on-one mentor and finding that one adult who is a significant connection to that kid. And then we would find mentors for those kids, and then we would go and measure again. So we repeat that cycle with each strategy. So it both helps us create a program, a strategy, and then evaluate if it's working as we implement it.
Great. Thank you, Claudia.
Thank you. If there are no other questions, I think it's almost 2 p.m. Yep. So it's time to go back. It's almost 3 p.m. Go back